Welcome back to Good Day State Line. 1 year ago this week, we lost Alex Trebek to pancreatic cancer, and he's not the only person we've lost to this disease. Tonight, we are chatting with the president and CEO of PANCAN, Julie Fleshman, about early detection. Hi, Julie.
Hi.
You know, I love getting the chance to talk to you. We've talked a few times. One of the reasons is my mom is a pancreatic cancer survivor, so she is coming up on 15 years of being a survivor in less than 3 weeks, which I know is pretty outstanding, literally, you know, in an astonishing way, and outstanding from the norm, right, Julie?
Yes, absolutely. I'm always so happy to hear about your mom. She's an amazing inspiration to all of us.
And it's funny because I was reading all the notes that we were going to be talking about today, and I was like, oh, I can't wait to tell Julie my mom next week is going to get genetic testing, which is literally what you're going to tell us about, isn't it?
Oh, that's amazing. Yes, that's great news.
All right, so Julie, tell us a little bit about the importance, obviously, of November in regards to pancreatic cancer, and then about what's going on in the genetic testing world.
Yeah, so this month we're really encouraging patients and family members, healthcare professionals, and the public to talk about testing. Talk, test, take control. And what that means for patients specifically, like your mom, we recommend that all patients after they're diagnosed with pancreatic cancer to get both genetic testing for inherited mutations and testing of their biomarker testing of their tissue sample in order to, that information will help them to determine which treatment option may be best for them. And for family members of a pancreatic cancer patient, so first degree relatives, so a mom, a dad, a sister, a brother, or a child, we recommend that they consider getting genetic testing to better understand their risk of pancreatic cancer.
So I know for sure that this is something that no one was talking about 15 years ago. How new is this genetic, testing going for PANCAN?
Yeah, it's really exciting. It is definitely new information based on more recent research. Certainly something that when my dad was diagnosed 21 years ago was not offered to him, and I know not to your mom either. And I'm so glad, though, that she's going to take advantage of this new information and go and get genetic testing. And by your mom, as the pancreatic cancer patient getting genetic testing, that information will also provide information to your entire family about your risk of pancreatic cancer.
There's so much new research every single year, which is a good thing, right? But that's also, it's not one of the leading cancers that are researched. So what can we do, all of us, to make sure that if one of our family members are diagnosed or if ourselves find ourselves there, like what can we do as a community?
Yeah, so, one of the challenges of pancreatic cancer is there is no early detection test, and the symptoms are quite vague. So we want people to be educated about what the symptoms are: lower back pain, stomach pain, jaundice, the yellowing of the skin in the eyes, new onset diabetes. These are things that people should be aware of so they can be their own best advocate. And also for, again, first degree relatives of a pancreatic cancer patient, they should consider talking to a genetic counselor to understand their risk of pancreatic cancer. And while understanding your risk is not an early detection test, it doesn't tell you if you're going to get pancreatic cancer, it will make people more aware. And we want people to be aware. We want them to be vigilant. And when you're not feeling well, to go talk to your doctor and be your own best advocate.
Okay, Julie, so where can we go to get a ton more information? Because I know it's out there.
Yes, please go to pancan.org for more information about pancreatic cancer, about the topic we're discussing today, testing. We also have an amazing patient services program where people can call free of charge and talk to one of our trained case managers, both patients and family members, to get more information. And people can also go to pancan.org to find out how you can get involved and make a donation so we can continue to invest in more research and have these kind of advancements every year, like you said.
All right, Julie. Well, of course, it was so great talking to you. Thank you so much for joining us tonight.
Thank you for having me again, and so glad to hear your mom continues to do well.
Me too. We'll be right back with Tuesday Trend.